Hello, everybody, and welcome back to PX Talk. Today we have with us one of the legends of ophthalmology, Dr. Richard Lindstrom, originally from Minnesota, founding eye partner of Minnesota Eye Consultants, a leader in the cornea, cataract, and refractive surgery space, and more than just a clinician. He's been on the forefront of many of the changes and evolutions in ophthalmology. He's an active venture investor as well as advisor to numerous companies. He served on a number of boards as well. And he is an inventor, has over 60 patents. He's a teacher, and he's an author of many, hundreds of articles, dozens of book chapters. And I'm pleased to say that Dr. Lindstrom and I co-authored several book chapters in the area of laser cataract surgery. So Dick, so good to have you with us today.
Yeah, thank you, Sharif. It's always fun to talk to you. So looking forward to it.
Well, we have an audience that includes not only ophthalmology, but doctors across multiple specialties. And with one thing in common, they all want to improve the patient experience. And as you know, that was the subject. It's been a lot of my work in my career, the subject of the book, of which you were so kind to lend a quote for the back cover. But I want to go back in time because you told me once about one of early on in your career. You talked to me about a doctor, Malcolm McCannell, I believe was his name. And you said he was a profound influence on your view of what the patient experience and patient encounter should be like. So tell us about Malcolm.
Yeah, so I've been in ophthalmology 45 years now and in medicine a little over 50. So I go back a ways. But when I chose ophthalmology as a medical student, I asked my advisor to connect me with a busy private practitioner, and the noted one in Minneapolis at the time was a gentleman named Malcolm McCannell. And I'd been on the wards at the university and the VA and Hennepin County, and while we worked hard to provide quality care, I would say not a lot of emphasis on the patient journey, if you will, as far as making that better. And I was introduced to Malcolm, and he was an early proponent of making sure that the patient experience was important and prioritized. And early on, he was using high quality, ophthalmic technicians. That was way before its time. He realized that since he wanted to be a high volume surgeon, that the more patients you saw in the clinic, the more surgery you were going to do. So it mattered to him that he was efficient in regards to the journey of the patient, through the office. He monitored what patients thought about their experience and made incremental improvements continuously to make the patient journey more positive. And for that reason, he was by far, the highest volume clinician in Minneapolis at the time.
So it was more than just the medicine. As you describe it, can you think of a particular principle or value, something he imparted upon you that really kind of drives home what he was about?
Yeah, he really tried to connect with the patients, and so very important things to him. He said to me, unless you touch the patient, they don't hear anything you see. In the COVID era, that's obviously changed, but in those days, that was important. He said, never talk to the patient until you have the rest of the family in the room, and make sure that the family has a reasonable experience in the process as well. And then sort of monitor what the patients think about their experience and listen to what they say and incrementally, try to make the experience better. But patients flocked to his office because they had a positive experience. They also got high quality care, but if I'm honest about it, the professors at the university gave high quality care, but not such a enviable patient journey in that setting. We had patients that would come and bring their lunch and dinner because they'd be sitting out in the hallway for 4, 5, 6 hours in those days at the University of Minnesota before their appointment was over. And not so. His program was quite efficient and high quality still as far as the quality of care, but very patient friendly. And when I left academics, went into private practice, I found I couldn't really make the patient journey that good at the university when I was even an influential full professor and had an endowed chair. When I went into private practice, that was important to me. So I made sure that even 30 years ago when I founded Minnesota Eye Consultants, that patients, didn't wait long in the waiting room. They got into the system. They were immediately, taken in. If there was going to be a little delay, they were told there was going to be a little delay. I had, a nurse who would go out and let the patients know I was running a little behind and give them candy or whatever it took. And, we had a very positive and efficient patient experience from day one. And I think that helped me build my practice as well.
Well, it's amazing because as I listened to you talk about Malcolm McCannell and what he did, he practiced in the era before there was an internet, if very few computers, right? It was a kind of pre-computer time.
I don't think there were any at the time. So
yeah.
when I visited him first. So.
Right. So no social media, no easy way to spread the word. But he built a practice based on some time-tested principles that do not change about how we view what's important. I think that
patient word of mouth, and of course, in those days, we also had a lot of doctors referring patients in to surgeons, which is what he wanted to do, mainly pathology, but they did primary care as well. And so the patient would go back to the referring doctor and say, that's the best experience I've ever had. And that referring doctor was likely to send another one. They were talking to someone of their friends or family and they needed care. They would say, that's the best experience I've ever had. And perhaps the best example of that, because I go visit them every year, that I'm introduced to every year is Vance Thompson Vision. As you know, John Berdahl and Vance are close friends. John Berdahl was a fellow, and they say they've tried to emulate the things that we did at Minnesota Eye Consultants. But to be honest and direct, when I visit them, they're better at it even than we are. They're a little bit smaller. It's maybe easier to control, but it worked 45 years ago and it works today. They're busier than they can, than they want to be in some ways. The same thing, that I experienced when I started my practice. I was almost instantaneously busy because I prioritized the patient journey, the quality of the experience. I let patients know that I really cared about them and that they mattered, and that their time mattered. And I think that's important.
This notion of time and respecting time, which sounds like Malcolm did, you did at Minnesota Eye Consultants, and that legacy continues. And now the only thing that's changed is the tools. We've got better tools and better technology to help, but the principle is timeless, and it's really wonderful. And if you kind of now go to present day, Dick, and your involvement in seeing how private equity has come into the specialty of ophthalmology, it's been in dermatology, dentistry, and others, long before it came to our shores. Private equity, a pandemic, all the stuff happening together. You could view it as crisis, or you could view it as opportunity. You could view it either way. What's your view? And I think both in terms of just the ability for the private practitioner to succeed, and what you would guide them on in terms of patient experience in this modern era.
Well, this has been the most difficult year since I've been practicing in medicine for myself and for my colleagues and employee team members and for my family, and at the same time it's been probably the most difficult year for the patients as well and their families. It's been a high stressful time, and one of my core thoughts has been that this is the time to basically dress up and show up, and demonstrate as a leader in a practice that you appreciate the pressure and stress everyone else is under. And I also say that when I see my patients now, I basically acknowledge, that I understand that they're more stressed than average, and this, I think, is important for the clinician to take a leadership position in that regard. We had a very V-shaped recovery in ophthalmology in our private practice. Some of the institutional practices, excuse me, are still struggling, but the private practices have come back strongly. So we're back full bore, but we do more cleaning and screening. Everyone's masked. Our parking lot is a waiting room, and we don't get to have the patients in. We don't get to touch the patients, even though that was maybe less appropriate in the last few years as our norms have changed. But it's still important, I think, for the clinician to set an example, and I call it dress up and show up, but also, be robust to it, to persevere, to let everyone know that, they're still important. They're going to get high quality care, and let the team know that they're important and that there's a future.
Well, there's no question that you can't have a great patient experience without a great staff experience, or having the team be kind of happy as well, because if they're not, that negative will
That's
spill
right.
over.
That's right.
And would you say, is patient experience in a post-pandemic world, is patient experience less relevant or more relevant for the private practice?
I think it's probably more relevant, but more difficult. So that personal touch, is probably more difficult than it was, but it's still possible. But I think we all have to maybe reach even a little deeper than we did before, so that we make sure we do make those connections. We might have to make a few more phone calls from the practice. It doesn't always have to be the doctor, to connect with the families and make sure they don't have any questions, because they maybe weren't in the room and they understand what their 80-year-old, 90-year-old, mother or father, has in store for them. So I think it's probably, increased our requirement, to have an appreciation and empathy, if that's the right word, for the environment.
And that goes right back to what your mentor all those years ago, showed you, right? He proved.
Yeah, it's true. He set the groundwork, and we're all influenced by those experiences, and I was fascinated at the difference between the way, my professors, and I don't mean this in a negative way, but the way they managed the situation and the way he managed the situation, with arguably equally sick patients with equal demands. And the attitude a little bit at the university where I work was that, if that basically, if their eye problem isn't bad enough that they're not willing to wait 4 to 6 hours, they shouldn't be here. Whereas Malcolm's approach was that he wanted that they were already stressed, and his goal was to reduce their stress and make it easier on them and their family. And for that reason, he prospered, but he also provided extraordinarily high, personalized patient care.
And through a marketing lens, we would say that he was truly differentiated based on that experience.
At that time in the marketplace, he was pretty unique.
Yeah, it's incredible. And you talk about waiting 4 to 6 hours, and that's really unthinkable today, right? Just in our instant world, instant Google-driven world, it's just unthinkable. But
yeah, today people would get up and walk out, but it was a different era. So.
Well, let's now talk about just another part of post-pandemic, and that's something that's been very important in your chosen specialty, which is the interaction of colleagues together and with industry that happens multiple times a year at these various meetings, some very large like the Academy, some smaller and more intimate like OSN New York, that you are involved deeply in all of them. What's your outlook about when we'll be able to get back to seeing each other again?
Well, my first planned meeting that I think is actually going to happen is towards the end of May, what we call Hawaii Eye, is in Maui this year. It's our meeting's been ongoing really since the 70s. And it's had strong attendance, usually 1,000 to 1,200 participants. I think we're going to be able to have this meeting. Hawaii's a unique environment. It's a little bit more outdoorsy. The hotels are open and in business, so I think we're going to be fine. I think that'll be the first big meeting that occurs. We'll probably get maybe 500 or 600 rather than 1,000 people there. Some people are still restricting their travel. Some institutions are restricting their employees' travel, but it'll be a meaningful size meeting, and I think it's going to be a go. And then as I look at the rest of the year, there's several meetings that are scheduled that I anticipate will occur. So we've spent, that would mean that for me, I've spent 14 months without a meeting. I came back in late February from a meeting called Caribbean Eye, and that was the last meeting for me because things shut down in March. Other than we certainly did a bunch of virtual meetings. ASCRS is going to happen. Telling it like it is going to happen. ACOS is going to happen. Academy is going to happen. It's still a little challenging to go to a meeting in Europe, for example, or for Europeans to come to a meeting in the US, or even maybe desire to, take that type of a long trip. And the challenges are a little bit higher. But as far as the American doctor, they're going to start to go back to face-to-face meetings. They're going to be a little bit different. They're going to be more spread out instead of, the row of people sitting next to each other. There'll be tables with, social distancing. You'll be wearing a mask, maybe during the meeting, but certainly on your way, to the meetings. If it's a breakfast or lunch meeting, obviously you have to take the mask off to eat, but those will probably be outside, for example, in Hawaii in a tent with a breeze blowing by. So it'll be different when you go through the exhibit hall. There'll be an exhibit hall, but it'll be one-way traffic, and there'll be a limited number of people in the booth, and it'll be controlled in some fashion in that regard. But I mean, we're going to have to experience it. But the cities, the ones that where conventions are critically important to them, they're back open for business. So ASRS is going to go to Las Vegas, and conventions are critically important to them, and certainly Hawaii, conventions are critically important where Hawaii is going to be. Even New York, OSN New York looks like it's going to be a go this year, so they're going to open back up, and New Orleans for the Academy. So we'll be back at it through the summer.
Well, let's hope, right? Let's hope, because this is there's still a lot of unknowns, but we're learning more and more every day.
Yeah, that's right. Well, we can get vaccinated now, which will increase, but also we got relatively rapid testing. So I mean, to go to Hawaii, you'll have to get a negative test before you get on a plane, and a negative test after you get on the plane, or you'll still be able to stay, but you'll be quarantined in your hotel. But we're going to probably move to the point where if you've been vaccinated, maybe the testing requirements will be reduced, but it's just going to be incremental. I mean, case volumes are falling rapidly, around the world, actually. And if you follow that, but even around the world, case volumes are following, and we're learning how to treat, people who get very ill better, but people who get vaccinated don't get very ill. So there is some good news here, but it's not over. And you know what, we're going to have this in the background forever. We've just like we've had influenza since 1918. It's
right.
Maybe not the H1N1 that we had in 1918, but we're going to have to get revaccinated every year. Hopefully, eventually we'll have a combined influenza, COVID-19 vaccine that we can get each year. But there'll be some people, just like there were with the flu, getting sick and even dying every year. So we've got another, problem out there that's going to be with us forever, but we're going to learn to live with it. But you'll see a lot more people wearing masks in the airport. You'll see a lot more people wearing, I think, probably in the office, certainly as well, and more careful cleaning and the like. But we're pretty adaptable, we humans, and I think our patients still have vision problems, and the people that are taking care of patients with other problems, they have the problems. They still need the care. They still want the care. You can't do it all by phone, although you can do some of it by phone. But I think it will work its way, back in quotes towards. I think it will be in quotes a new normal. But that doctor-patient relationship, that quality experience in the office. If a doctor, wants to be busy, that's going to have to be important. And one other quick thing, I might just jump ahead, and that I teach my colleagues, but I think it's true in every field, is that office practice is becoming more important every year. And so many of us that are in surgical subspecialties, we spend 80-90% of our time thinking about what are we going to do, with that one day in the OR, and how do we make that efficient, and how do we make that a positive experience. But office practice, both financially, but also where you generate surgical patients, is in the office. So the one thing that Malcolm taught me early on in those days, he said, every 8 patients I see, I generate a surgical procedure. And so the more patients you see, the more surgery. And it's the same today, and people forget that. And not only that, nowadays the office reimbursement every year goes up. So I've been in practice now for 45 years, and every year my reimbursement as a surgeon has gone down, and every year my reimbursement in the office has gone up. So if people take a careful look at it, they'll realize that there's a lot of revenue to generate in the office as well, if they make it a positive experience. And there's a lot of cash pay procedures in ophthalmology, at least, that are occurring in the office today as well. So we and our administrators and our consultants like you, Sharif, we need to spend more time in our offices paying attention to, that part of the patient journey, and just not worry all the time that they have a great experience on that one day in the OR.
Very well said, Dick. And I think I look at this and what you talked about, whether it's the meetings or the kind of emphasis on the office, it's just ongoing. You're on the forefront of all these changes in ophthalmology. And we so appreciate all your contributions to the field to make ophthalmology better for doctors and for patients and everyone else associated. And with that, I want to say thank you for joining me today. I want to thank everyone for listening. Come back to pxmovement.com for additional video interviews, additional resources to help you improve the patient experience. And with that, we say goodbye. Until next time, I'm Sharif Madabi. Thank you.
Thank you. Thank you, Sharif. Great day.